So today, Livy and I are going to be talking about the service learning project that we did this year, which was participation in the first year MSOT simulations. So first of all, for our plan, we had a project summary of students. So we, as the students, were responsible for the design, implementation, and active participation in first year MSOT simulations, where we focused on physical scenarios, ethical scenarios, with intention to further the education of the first year students in a safe learning environment. So what the students did, what we did is participated in one pre-designed physical simulation, and then we implemented an evaluation focused on outcome measures. And then we also developed and implemented one ethical simulation with outcome measures as well. The materials and assistance were provided by the service learning project coordinator, Dr. Jean Prast.
So community needs. For our job was to assist in providing educational opportunities for first-year MSOT students in a safe learning environment where errors can occur, and then we could also offer feedback. This is supported by research which finds correlation between the use of simulation-based learning and improved complex skills, regardless of learners' prior knowledge on a specific topic. Learning objectives. For us, we will demonstrate the ability to plan, implement, and evaluate participant-led simulations focusing on physical and ethical scenarios supporting participant learning. We will also demonstrate interprofessional communication skills, both verbally and written, centered on participant strengths and areas of improvement. For our population served, being the first-year MSOT students, we'll have them follow simulation completion. They will demonstrate appropriate competence in clinical reasoning, planning, and collaboration to provide client-focused occupation-based interventions as evidenced by active simulation participation. We will also have them, following simulation completion, demonstrate the ability to effectively document evaluation treatment findings in accordance with professional standards as evidenced by completion of a SOAP note and client-centered goals.
So for the actual implementation of the project, the simulations that we participated in, the first one was the physical condition simulations, where we fulfilled the roles of either a patient with a CVA or a hip replacement, while the first years performed an initial evaluation as the OT. The second one that we made, we actually developed and role-played 3 different ethical scenarios, followed by discussion questions for each scenario. And then for one of the scenarios, constructive feedback was also given from the first year point of view on one of the scenarios. And then the third one was the evidence-based and occupation-based intervention, where first year students provided evidence and occupation-based treatment for patients whose roles were played by us, the second years.
So roles and responsibilities. Our roles were to develop evaluation tools, materials for the ethical simulation, and facilitate first-year students' professional skills during simulations. We also were to fulfill selected patient roles during physical condition simulations and assist with development of ethical decision-making skills through a facilitated role-playing of simulated scenarios focusing on MSOT core values. And then we also facilitated first-year student discussion post-role-playing to address core values identified during the session, performance, as well as areas of success and improvement.
So the involvement of the population that we served, which was the first year MSOT students, they had hands-on involvement with the simulations by participating as an OT or a family member of the patient, ability to use their critical thinking, activity analysis, and decision-making in order to identify ethical liabilities and then solutions to workplace problems. They also had indirect involvement in the form of documentation after the simulations in order to further improve their documentation skills. And the impact of the project overall will be affecting their future professional, clinical, ethical, and documentation skills of the first years.
Evaluation tools. For the physical condition simulation, we had a non-standardized checklist to evaluate professional skills during the simulation. And following the session, we did a SOAP note to improve documentation. We had the students do a SOAP note. Ethical dilemmas and providing constructive feedback. We had discussion questions following each ethical scenario presented. And then we provided constructive feedback from the perspective of someone involved in one of the ethical scenarios.
So I'm just going to run through these. These are some of the materials that we developed. So this is our checklist that we use during the physical conditions simulation. And then this is one of the examples of the SOAP notes that we received. So we asked them to write a SOAP note based on the session that they did, whether they were an OT or a family member. And then we, as the second years, provided them feedback and then sent it back to them. So these are all the comments that I had on this person's SOAP note. This is one of the ethical dilemmas. So it says the directions at the top and the roles, and then the discussion questions following the scenario after we acted it out. And this is another one of those scenarios. And then the last ethical scenario, we actually had the students provide constructive feedback, either from the perspective of the student or the supervisor, depending on which side of the room they sat on. And we had them submit this in order and talk about it in order to further their constructive feedback skills.
So outcomes. Our outcome measures, we sent out a survey to first years regarding overall participation of second year students in simulations. We did receive 10 responses, which, yeah. And then we also sent one to second years regarding opinions of simulations, evidence, occupation-based intervention simulation, and just general feedback, and we received 20 responses.
So from the first year's outcome survey responses, we had them rate the following statements. They said that the second years were generally prepared for class. They agreed or highly agreed. The ethical presentation and simulations were well thought out. One was neutral, but mostly agreed or disagree, or agreed or highly agreed. Second years were organized and presented information in an understandable manner. There was one student who disagreed, some that were neutral, and then most agreed or highly agreed. And the second year's involvement in simulations was beneficial for my learning. There was a neutral, and then mostly agreed or highly agreed again. And then we had them rate what they learned as a result of the simulations, including questions such as my confidence as a future OT increased overall. I am more confident in my ability to build rapport with my future clients. I am more comfortable in handling tough conversations with a client or fellow coworker. I am better prepared to think on my feet during treatment sessions, and I feel more confident in addressing safety concerns with my client. Most of them were neutral to agree to highly agree, except for a couple who disagreed to the confidence as a future OT increased overall and the confident in addressing safety concerns with their clients. So there were a couple students who were kind of unsure about that as well. The simulations, we asked them which one was their favorite out of the 3 that we participated in. The majority of students said that their favorite was the evidence-based and occupation-based intervention simulation, although a few of them also said that the physical conditions where we participated as the client with the CVA or the hip replacement, those were the highest scoring. And then all 10 people who responded said it was meaningful to have the second years involved in simulations. We also asked students what one thing was that they wanted to improve with second year's involvement in simulations. So I'm going to let you guys pause and read through some of the feedback that we received on each of these. And then we also had what is one thing that you'd like to stay the same with the second year's involvement in simulation. So if you'd like to pause and read the feedback as well for that, you can. And then we also asked for any other comments or feedback that they had for either the second years, us, or Dr. Prast for future simulations. And then we also had our second survey for the second years in order to rate simulations overall. So we had them rate the following statements regarding simulations in the classroom. that simulations are more beneficial to my learning than didactic coursework. Faculty involvement in simulations heightened my understanding of core topics, and feedback from simulations helped me to become a better OT in the future. Most people were either highly agreed or agreed. There were a few neutral ones to the first statement. And then we asked specifically for the evidence-based and occupation-based intervention simulation because that was something that was newly implemented this year with the first years. And our role was to observe, take notes, and then fill out a worksheet on it as second years. So we had them rate the couple statements that said, I felt that observing the first years was beneficial to my learning, and I felt that the simulation environment was more beneficial than the occupation-based kit project that was done in the past. So most people agreed to that, although there were a few neutral and disagreeing responses who felt that observing the simulation was more beneficial to their learning. So maybe something to look into for the future. And then again, we asked a similar question to the second years that we did the first years as what is one thing that you would improve regarding simulations? Again, if you'd like to pause and read this feedback, that'd be great. And then what is one thing you would like to stay the same regarding simulations? And then other comments and feedback regarding simulations overall.
So Lincoln benefit to student education. We had feedback that positively supported the use of simulations, as well as second year MSOT student involvement for student learning of core occupational therapy values. When compared to didactic learning and other project-based activities, the students recognize simulations to be more beneficial to the understanding of course content. And it provided experience for second year participants through opportunities such as developing and implementing role-play activities, providing constructive feedback in a professional way, and reviewing course content for future fieldwork practice. Lessons learned and statistics. So modifications may be made to continue the evidence-based occupation-based intervention simulation, as 71% of first-year students chose this to be their favorite simulation in comparison to the physical condition simulation and ethical dilemmas providing constructive feedback scenarios. 84.2% of second years also agreed or highly agreed that this simulation was more beneficial than the occupation-based kit created in the past. And 47.3% of these students agreed or highly agreed that it was beneficial to observe these simulations as second years. A quote, I think that participating in more simulations with the first years would be very beneficial for both parties involved. It would give the second years a chance to reflect on what skills they could work on, and the first years would be able to learn in a more hands-on environment. So overall, second year should provide more feedback following first year simulations, offer more unexpected behaviors for a sense of realism, and be more constructive when possible. But we'd have to say positive support from first year MSOT students suggests that second year involvement in simulations should indeed continue as a service learning project. And those are our references. Well, reference.
Thank you so much for taking the time to listen to our project. And if you have any questions, please reach out to Livy or Paige.